So today I can report there is an increase of 89 COVID-19 cases on yesterday. 48 of these are confirmed cases and 41 are probable cases. There are no additional deaths to report. I can now report there are 156 cases who have recovered from COVID-19 infection. So the total combined confirmed and probable cases in New Zealand is now 1,039. Today there are 15 people in hospital with COVID-19 infection, and that includes 3 in intensive care units around the country, 1 in Wellington and 2 in Auckland. 2 of those people are classified as being in a critical condition. I don't have any further details or comment to make on those cases and do ask you respect the privacy of those folk. From our lab numbers, we can report a 7-day rolling average of 2,448 tests per day. The total number of lab tests completed to date is 36,209, and there were 3,093 tests processed yesterday. As mentioned, we continue to have sufficient capacity, more than sufficient capacity, to do the testing that is needed, including under the expanded case definition. For those cases we have information on, 45% have a clear international travel link. A further 36% are contacts of known cases, including those in the clusters we have around the country, and we have confirmed community transmission of 1%, and 18% of our cases are still under investigation. We now have 12 significant clusters around the country, with a new cluster in Canterbury and a further one in Auckland. This was a smaller cluster that has now reached that 10 case threshold. The clusters with the highest number of associated cases remain the same, although the case numbers have gone up slightly in each. The wedding in Bluff has 58, the event in Matamata has 56, and the cluster with the largest number of cases remains the Marist College cluster in Auckland with 66 cases. The ethnicity breakdown of confirmed cases is currently European 74%, Asian 8.3%, Māori 7.6%, and Pacific 3.3%. More details on all of these matters are on our website. A quick word on contact tracing. There's been a significant increase in our national capacity to undertake contact tracing, both within our public health units that have additional staff, but also through our national close contact service. As of Saturday, 4,909 close contacts had been traced by that national close contact service, which was stood up on the 24th of March, and 702 contacts were traced on a single day on Thursday. The team working inside that centre are now making over 2,000 calls per day, and there are 190 folk working in shifts there. Over the next week, there are a couple of areas that I'd like to provide more information on, and just signalling those ahead. One is on mental health and wellbeing, a range of initiatives that are being implemented to support people in self-isolation and those, of course, the population of New Zealand who are isolating at home in their bubbles. The initiatives are part of a $15 million package of investment into mental health and wellbeing that's been announced by the government. And the second area I'll provide a little more detail on during the week is our Māori Response Action Plan. I'll hand back to you, Prime Minister.
Thank you, Dr. Bloomfield. As you will have heard from the Director-General, we now have 1,039 cases in New Zealand, with the 89 cases that have been reported today. While I don't want to draw too many conclusions at this stage, you will see that our cases have in the last few days been relatively steady. We haven't seen the exponential growth that others have, the kind that leads ultimately to an overwhelmed health system. That is a good thing. Now what we need to do is see those numbers start over time to come down. I'm aware, though, that every time we see new cases, it may be hard to see success. But we can be sure that what we have done as a country since the very beginning of COVID-19 is making a difference. Economist Rodney Jones was interviewed this morning and talked about some of the modelling that has been done using the expertise of his team, including a biostatistician, and using key learnings and expertise from the outbreak of SARS. This is modelling that I have seen over the last few weeks and have continued to monitor closely, especially given at several points it has been accurate in predicting New Zealand's case numbers. On the eve of our lockdown, his modelling projected we had the potential to face as many as 4,000 cases this weekend. We're instead at just over 1,000. Those 3,000 fewer cases shows the difference that cumulative action can make. 3,000 fewer people sick with COVID-19, 3,000 fewer people passing the virus on to others, and then to others, and then to others. We can and we must continue to break the chain of transmission. But as Rodney said, we need to get to half time and perhaps a bit beyond that to see the full gains of the lockdown. But we have made a good start, and the decisions that we've made to date have made a difference. I've also seen reporting and statistics from Google that gives us some insight into our reduction in movement as a nation. That reflects impressively high levels of compliance by New Zealanders with the requirements of being at level 4 and reducing contacts with others. There's been an overall reduction in movement in places of retail and recreation of 91%. Even visits to the supermarket and pharmacy, which remain essential services and open, have dropped by half. Going to parks is down by nearly 80%. And while we are doing well at alert level 4, we also went earlier before that point in order to ensure the virus wouldn't have a stranglehold here. And that was the case for many of our measures. New analysis by the Ministry of Foreign Affairs and Trade shows we closed our borders 25 days after our first case. Germany took 49 days, Spain 52, Australia 55, Singapore 61. Our first economic package was in place 18 days after the first case. Most countries took more than 40 days. Ours was 6% of GDP, bigger at the time than the UK, France, Germany, Italy, Spain, China, Korea and Japan, and on par with Canada. Our case rate and death toll is well below other comparable countries. Yes, we had the benefit of time because our distance and because our early border and mass gathering measures also have made a difference there. But we had the benefit of a window of opportunity. We had the benefit of witnessing a terrible trajectory overseas. You can see now just how small that window of opportunity is to try and stop community transmission. Going hard and going early appears, though, to be paying off for us. The lockdown is the best way to stop the virus, and it is also the best thing for our economy by making the pain as short as possible. So I say to New Zealanders, be proud of your efforts that you have all made, the sacrifices that you have made. It is making a difference. Now is the time, though, to remain focused, to not let up, and to keep our eyes on the mission that we all jointly share. This is why we have strengthened efforts to go after those who aren't sharing that mission and who appear to be breaking the rules. As Dr. Bloomfield and the police announced yesterday, a new Health Act notice has been issued to firm up the guidance around the rules in place during Alert Level 4 and ensure the success of the lockdown and help move the country out of it as soon as possible. And the police are enforcing these guidelines. Over Friday and Saturday, police completed 795 prevention patrols in communities across the country and undertook 990 reassurance checks at essential services such as supermarkets, petrol stations and pharmacies. While compliance has been generally strong, there are still some who I would charitably describe as idiots. A 38-year-old Christchurch man arrested last night after being seen on a video online coughing at people in a supermarket I include in that description. He has been charged with endangering life by criminal nuisance and obstruction of an officer of health and will be appearing in court tomorrow. Before I conclude, I want to dwell briefly on some of the discussion I've seen emerge over the past few days over what kind of public health response is best for the economy. I've said it many times before and I'll say it again. No matter what it is you favour, the solution is the same. Fight the virus. A strategy that sacrifices people in favour of supposedly a better economic outcome is a false dichotomy and has been shown to produce the worst of both worlds, loss of life and prolonged economic pain. We need only look to history here as a guide. There is research available that looks at, for instance, the 1918 Spanish flu. Times may have changed, but the lesson overall is that those who worked zealously to stem the spread did better economically in the aftermath. That is not to say there is not currently pain. And for those who have lost jobs, for businesses making difficult decisions, and for those essential services providing the frontline support networks we all rely on, I know there is a real and genuine struggle in New Zealand right now, and I don't carry that lightly. That is why the $5 billion paid out for wage subsidies within a couple of weeks has been so important to cushion the blow of going hard and going early as we have in New Zealand. But nevertheless, we are likely to feel the long-term effects from a global downturn. As the Minister of Finance said on Friday, our message to business is to hold on to your people, give them the wage subsidy if you need to, and have a plan for coming out the other side. In particular, plan how your business will operate in different levels of the alert framework. The government's focus this week remains doing all we can to stop the spread of the virus so we can move out of lockdown as soon as possible. Our efforts remain focused on good levels of testing across all regions and getting a better picture on community transmission, continuing to scale up our contact tracing efforts as the Director General has outlined, and ensuring New Zealanders' businesses are receiving the financial support they need. I also expect this week to receive further advice from the Ministry of Health and my Chief Science Advisor and others on the evidence base needed to have confidence we do have the virus under control and therefore can move with certainty out of level 4, and the measures that will need to be placed at level 3 to ensure we're preventing any risk of further outbreaks. Finally, a public service announcement. Daylight savings ended overnight, and this is the time when people are usually asked to check their smoke alarms. And as we're all at home a bit more than usual, I'd say this is the year not to let that one slide.